Hi, Dr. Oxford. Nice to meet you.
Nice to meet
Mhm.
you too.
Great. Well, the gang's all here. Thanks for making time to have this fun chat with me. I'm thrilled to have two great veterinarians to talk with. I thought before we get started, while we're waiting for folks to join, maybe just tell me a little bit about your practice, what kinds of animals you see, and what you like to do most. Dr. Hammond, why don't you start?
Yeah, of course. So I work at a small animal practice in downtown Charleston. We see anything that will reasonably fit in the building. So the majority is still dogs and cats, but we do also see pocket pets. We get reptiles there, some birds. So that's really fun. I enjoy that aspect of it. I still, I still stay away from the scaly, beaky, flyy things. I prefer the fluffy, four-legged, cute things. But I'll see the others if my colleagues are unavailable, because of course, I never want to leave anything without care.
Of course.
But my love is the is the fur
Right.
and fluffy things.
Sure.
And that's really fun. I enjoy that. But yeah, I think I mentioned already, located in downtown Charleston, South Carolina.
Great. And what's the best part about in your practice for you?
Just the best part of like
Being a
where
veterinarian.
I work. Oh my gosh. Honestly, it's just helping. Like when I can make a difference in an animal's life, no matter how big or small, that is the most rewarding part of my
Right.
career. So, when somebody brings an animal to you and they have a concern and you are able to fix it, it's amazing. And there's not, there's certain times where no matter what you do, you can't fix it. But when you can really truly fix something, and it's the best feeling. There's nothing like it.
Great. And Dr. Oxford, how about you tell us about your practice and what you like best about being a veterinarian?
Okay, well, I am here in Los Angeles and I have a exclusively mobile practice where I do acupuncture and rehab. Probably 99% of my patients are canines. But I have, a handful of cats that I also treat.
Hmm.
And you know, I would say I would agree that just anytime you can help make an animal's quality of life better, and by doing that you're making the pet parents' quality of life better as well. It
Absolutely.
gives you such a great feeling, and it's it's a purpose, and that's the best for me.
Yeah. Well, I have to say that it sounds like we're very like-minded because that was the whole idea behind leap years is actually trying to get deepen that human-animal bond as an animal matures. And we get a lot, but not enough years with our dogs.
Mhm.
And so I'm thrilled to hear that with the two of you. Maybe we could just jump right in. So let me ask you, when is a dog old? Dr. Hammond, why don't you take that one?
Yeah, that's a great question, and I think it's a huge debate. I'm sure that if you asked 100 veterinarians, you'd get 100 different answers. The textbook is going to say like 7 or 8. They're just like, yes, but that's like calling women over 35 geriatric pregnancies, right? You're like, really? Is that like they're geriatric at 7? And because if you look at a dog at 7, are you talking about a 7-year-old Chihuahua, or are you talking about a 7-year-old Great Dane?
Right.
Because a
Mhm.
seven-year-old Great Dane, I might say, yes, that dog is entering their senior years. But a 7-year-old Chihuahua, I would say they're middle-aged. That's like a 40-year-old person. Like they have a
Mhm.
long time to live. And even, a dog to dog, breed to breed, you can't really compare, because I will meet some, Labrador retrievers who are 9 and they're old. They look old. They're having those senior problems. And I'll meet Labrador retrievers who are 9 and they act like puppies still. So I don't think that there's a one size fits all definition to when a dog is old. I think it's very dog to dog dependent, and I think we have to look at each dog as a unique circumstance. So I think a dog is old once they start showing signs of aging.
Yep.
And I'm not
Yeah.
talking about the little things like not chewing up things like a puppy anymore and not bouncing off the walls with the zoomies, but just starting to have, maybe not wanting to go on walks like they used to, or having difficulty getting up and down off the furniture, or maybe we're noticing some slowing down cognitively. I think that's actually where I would start to consider a canine truly old.
Right. So,
Mhm.
Dr. Oxford, I imagine that in your practice, you see some younger animals for maybe rehab and maybe some older animals to manage their pain, etc. What are the common signs that you would say that you would talk to pet parents about as dogs, start to need some additional attention?
Yeah, I mean, I would echo Dr. Hammond. It's not, it's not so much like when is a dog old, but like how is a dog old? How does a dog present when, they're looking old? And I look at signs of frailty. So you can see it in like muscle loss, and you can see bony prominences starting to get a little bit more pronounced. You can see it also associated with that muscle loss. You can see them getting a bit weaker and losing some of their mobility. And that would, translate to, maybe the dog is slowing down on their walk. So maybe this is a dog that always used to be like right up with the owner or in front of the owner, but now the owner is noticing, like, I'll ask them, are they a little bit behind you now on the leash? And they're like, oh yeah, they are. They're walking behind me now. So they're definitely like slowing down. And they are, this is a little bit more subjective, but owners can really tell when a dog is less excited and less engaged in doing their daily, activities that they used to always love to do. So maybe there's like a little bit less wagging the tail and a little bit slower getting up when the owner like jingles the leash. Yeah. So those are just some signs where you're like, oh yeah. And again, like that lab who's 9, he could be a little bit older than another lab who's 9, who's acting like a puppy. So it's because aging doesn't happen overnight. A dog isn't suddenly old on like their 9th birthday. It's a process, and some go through it faster than others, unfortunately.
Well, Dr. Hammond, tell me about that kind of middle-aged dog that the owner wants to be proactive and like do everything possible to make sure that their dog remains healthy. They put them on the best diets. Tell me, how do you counsel that person? Like, what would you be recommending?
That's actually my favorite time to talk to people. I'm like, yes, give me that like older middle-aged dog who's not like riddled with problems yet, but like we've gotten like ahead of them. So those are the dogs, like you said, we're kind of maybe like 6, 7, 8, 9. Maybe as Dr. Oxford mentioned, the owner's starting to notice that they're lagging behind on walks or whatever, and they come into the clinic for their annual and they say, oh, I noticed, this, that, and the other. And I'm like, yes, let's talk about it. Like, what can we do? So you mentioned, feeding the right food. Obviously, nutrition is very important. Maybe we can talk about introducing like an omega-3 supplement if they're not doing one of those already. That's actually my first like favorite go-to supplement for just like joint health. But on top of that, I also talk to people, in terms of what your dog can do. If you don't use it, you lose it. So we want to maintain our muscle mass. We want to maintain our range of motion and our mobility. And I'm sure Dr. Oxford could probably preach, from the mountaintops about that, because it's so much easier to maintain what we have than to try to fix it once it's gone or try to get it back. And it's almost impossible to do that. So I'll talk to owners about, here are some ways we can help to, maintain your dog's mobility, things that we can do to keep them comfortable, such as supplements. And I love that I can add leap years to that. I actually spoke about it 3 different times today in the clinic to clients, because we never had anything like this before. It was really, when people were like, what can I do? We're like, oh, here's some joint supplements, and here's some, tips to improve or help maintain their cognitive function, but not really anything to improve. So I'm always going to have that conversation of like, let's keep what we've got and let's work with what we have. So like, make sure you're getting lots of mental stimulation, and it doesn't have to be hard. These could be different treat puzzles. This could be taking your dog on a walk in a different place once a week, just so they get that new exposure, or going to a different dog park, taking your dog to, the doggy bars, or whatever fits your lifestyle. There's so many ways to get easy mental stimulation into our pets' lives. So, maintaining that cognitive function that they have. It's always, like I said, that middle age is the best time. And then in addition to all that, definitely wanting to do blood work at the same time, because we want to identify any possible underlying conditions that can exacerbate muscle loss or, reduced mobility, reduced energy. So we'll want to make sure that we're keeping tabs on those kidney values, those liver values, so that if they start to go up, we can identify and treat a problem before it gets so bad that the pet comes in really sick and there's not much that we can do for them once they are, old and diseased.
Right. Now, Dr. Oxford, I know that you have spoken at conferences about this topic, so I wanted to ask you about this idea about healthy cellular aging is kind of new, right? But so tell me, how do you think about that, or do you even talk to clients about that, or how do you approach that?
I do. I started getting, I guess, aware of cellular health in vet school and learning about all these chronic diseases, right? You're just like learning the textbooks, and you start to think about, why are certain dogs developing these chronic diseases? And also nowadays, why are so many more dogs developing chronic diseases at even earlier ages than they used to? So like, what is this whole concept, and how can we get to the root of, preventing chronic disease before it even starts to begin? And so you can take pretty much any disease, any chronic disease, and you can trace its root to, usually some kind of inflammation. And through aging and the loss of cellular health, you can understand how all of that inflammation is building, and how there's been a lack of attention given to this process in medical training. Our current model is kind of like, oh, we see a chronic disease, and then, okay, we've got XYZ drug to treat it. But if we start to really look at cellular health and look at aging as a process that is actually kind of like a disease in itself, because now we know that there are so many hallmarks or characteristics of aging and loss of cellular health, we can actually treat those as targets for intervention. So it's not this inevitable process that we just have to that we have to face, but now it is a process that we actually have some tools to treat, to try to prevent that chronic disease from forming. So yes, I talk to all my clients about this, like at the cellular health level. And that's why leap years has been just such a, just a phenomenal game changer.
Well, I feel like I'm talking to two folks on the front edge of kind of changing the paradigm of aging in dogs. So thank you for both of your efforts in that regard, because you said something really interesting, Dr. Oxford, and that is about aging as a disease. And I know in the human longevity field, folks are really looking at that. There's a clinical trial out of Columbia University looking to see if they can identify biomarkers, et cetera, so we can actually talk about aging as a disease state. So anyway, let's go back to talking to pet parents about aging. So if you had kind of the elevator pitch, the ride in the elevator with a pet owner, what are 3 things that you would say make sure you're doing for your dog? Dr. Hammond, how about you?
Yeah, I feel like I maybe touched on it a little bit in my last answer, but my number one tip is being proactive. So are you being proactive, when you want to do everything you can to prevent any issues from forming, because an ounce of prevention is worth a pound of cure. It's so much easier for us to prevent disease or cellular change, even than it would be for us to treat it. Because once it's happened, and you can't turn back time. You can't take all those disease processes away. So being proactive is the number one thing. I always tell people as well, especially for our senior pets, is you have to advocate for your pet, and you know your pet better than anyone else. So, something that I'll notice in practice is some patients will say, oh, well, the vet last year told me that this was nothing to worry about. And I thought, well, you were worried about it, and if you're worried about it, I'm worried about it, because you're clearly noticing that your dog is slowing down on walks, or not getting up, or not as engaged with you, not as excited when you come home and, I feel like it was an old way of thinking to say, well, it's just an old dog. It's just old dog stuff. It's nothing to worry about. I'm like, let's just check some blood work. Let's make sure we're not missing something. Let's see if there are anything we can add to, diet, routine, lifestyle, changes we can make around the house to make your pet more comfortable. What are some things we can change? Because if you're concerned, I'm concerned.
Good.
And the third one, I don't know. That's tough. I feel like those are my two main things. It's like, okay, be proactive and you know your pet best. And
Well,
the third one, I guess,
it could be a short elevator ride too. Will do.
yeah, okay, we'll stick with two. I feel like that was great. I like those answers.
Dr. Oxford, how about you?
Well, I like to tell people that we are understanding now that although aging affects all of us, only 30% of it is genetically predetermined, right? And so 70%, and some researchers estimate it as even more than 70% of it is epigenetic, or in other words, environmental and lifestyle factors that influence aging. So I'll, say, aging does affect everyone, but we can definitely do some things to slow it down, maybe even reverse it a little bit. And then I would also tell people that, to slow down aging, you can't supplement your way out of bad lifestyle choices, right?
Absolutely.
So, you have to start with the foundational good, healthy diet that is robust nutrition. There's a variety and really good quality ingredients, and not over nutrition, overfeeding, because that's a big issue. So that is one key element. And then also just making sure that you're getting adequate exercise, you and your dog. So those lifestyle factors are very, very important. And then leap years.
There you go. So let me ask a question. Here we're talking about leap years. How do you decide about the quality of a product that you would want to recommend? I mean, what are your criteria? Dr. Hammond?
Oh, yeah, I'll go first. This is a conversation I have all the time with clients, because there are so many options. And I know myself, even walking into the pet store, at first it just feels overwhelming because there's all these shelves and they're stocked with all these beautiful packages. And you're like, I just want a joint supplement. Like, what's the difference? And, and if we don't tell people what to look for, what are they going to do? They're going to go on their phone. They're going to type in joint supplement. They're going to see what's the cheapest and what can get to me the fastest, because they don't necessarily know, like, what to look for. So things I recommend is first and foremost, you want to look for good ingredients. So does it have the ingredients that will actually benefit your pet? So there are some joint supplements that don't actually have ingredients that are helpful. So if we're looking for a joint, we'd be looking for chondroitin, glucosamine, things like that, omega-3s. And then I always recommend looking for something that's manufactured in the USA. That's very important, right? Because it's better, we're better able to actually control and know what goes into that product and trust the manufacturing. And then, is it third party tested? That's also usually very important, because some supplements will not be labeled appropriately. There's no FDA regulation on this, so having a product that is third party tested is very important. And then I also highly encourage people to look for supplements that have research behind them. And that was one of the first things that I asked Jenny when we talked about leap years. I said, show me your research, because this sounds too good to be true. And they had done an incredible double-blinded placebo-controlled study with North Carolina State University Veterinary School, which is a reputable institution, and one that I respect. So I was really excited to look at that research and to see the clinical data for myself, so that I could know that this product was safe and effective when I share it with my clients.
Good. How about you, Dr. Oxford? What are your criteria?
Yeah, I mean, everything that Dr. Hammond just said, that the current good manufacturing practice label, that CGMP on there, means a lot to me. Because even if the product is not itself, FDA approved or labeled, it's definitely regulated by the FDA, the manufacturing process. So that means a lot in terms of quality. And then in addition to, the research behind it, which I think is very important, also knowing that you have a company that is standing behind the product. They're just not going to sell you a product and then if you try to call them, if there's an issue, there's no one there. So Leap Years has really great veterinary support and customer support. And I think that speaks very highly to the quality of the product as well.
Great. Well, thank you for that. Let's stick there a minute with you, Dr. Oxford. And, Leap Years has an NAD booster and a senolytic. So how do you talk to your clients about that for their dogs? Because that's something kind of new to cellular health and to pet parents.
Yeah, well, it is. And then in LA, it maybe isn't. Because I have a lot of clients that already are taking these things for themselves. And so the conversation is really easy with many of my clients. I mean, some of them have actually approached me about, is there something like this? And this was like right when Leap Years was first coming out. And I was like, actually there is. But yeah, when I talk to a client who isn't familiar with it, I basically introduce NAD precursors as these are molecules that are actually bioavailable when you take them so that your cells can generate NAD. And that is cellular energy. That's what every cell needs to survive and to actually perform its function. And without NAD, our cells die. And as we age, we lose the production of NAD. Our NAD production declines with that loss of cellular health. And so these NAD precursors help to, boost our NAD levels, which then can not only helps with, cellular energy, but helps drive DNA repair. And then the senolytic is a lot of people have heard of zombie cells because that's gotten a lot of press recently. So when I say zombie cells, most of the time people are like, oh yeah, I've heard about that. So I'll say, these zombie cells are basically senescent cells or cells that used to be healthy. They kind of have gone out of cycling. They're asleep, and then they've turned into these, zombies, which are now producing inflammatory products. And so it's driving your inflammation up, which is part of the reason why we develop chronic disease and have a harder time if we get sick when we get older than a younger person. So the senolytic is actually helping us to drive down inflammatory levels in our body.
Right. So what kind of patient, Dr. Hammond, do you think would most benefit from Leap Years?
I'm definitely recommending it to all of my clients that have dogs that are already showing signs of aging. So, they're having reduced mobility, reduced energy, reduced engagement, kind of most of the things we've already talked about. So, and many of these patients are already doing all the right things. So they're already on a joint supplement. They're already maybe taking a nonsteroidal anti-inflammatory medication to help with pain and inflammation. And the owners are probably doing what they can to support their cognitive function, but they're still seeing a decline. Definitely those dogs can benefit from Leap Years. But I'm also using it as well proactively. So for those dogs we kind of mentioned that are beginning to maybe show some subtle signs of aging, maybe it's not bad yet, we want to just stay on top of it, we want to keep them going. So then I'll say, let's go ahead and let's try this out, because this can help, prolong their health span and keep them healthy and keep them engaged with you and add years to that human-animal bond that you cherish so much.
Great, thanks. Well, we're coming close to the half past the hour, and I want to have time for some questions from the audience. And well, let me ask you, what questions do either of you have for me or for our Leap Years team that you'd like to ask? We may have already talked about everything.
Well, I have one.
Okay.
Lots of my clients are asking me, when is it coming for cats?
Yes, that's such a great question. Yes.
Yes. Well, thanks for that question. As an old cat owner, I can't say fast enough, but so it is next up at bat. Certainly, we are really focused right now on getting the word out to dog owners, and as soon as we make enough development costs. We have to be able to do the proper studies for cats. So we're working on that. We have some designed, just haven't pulled the trigger on them yet, but stay tuned. It's coming.
I'd like to request it in a liquid, please.
Okay, there you go.
Yeah.
Okay.
Yeah.
Yes.
Just while you're thinking about it, just gonna plant that seed. We would
right.
like
Tuna or whitefish? I'm not sure.
Yes, either.
Right.
Right. Okay, great. Okay, well, let's see. I'm going to ask our moderators if we have any questions from the audience. Let's see.
Dr. Oxford, while she's doing that, I want to tell you, I'd love to see like a video of you doing the rehab with a cat. Like if you have any videos, you'll have to post them because I would just love to see that.
It usually includes a little like those little sticks with the the little furry thing on the end of it. That's how I get most of the exercises accomplished with cats.
That's funny. Temptation.
They tend to be less food motivated than my dog patients, as you know.
Yeah.
Great.
Yeah.
Okay, well, we have one interesting question that I'll ask is someone wants advice on becoming a veterinarian. So what would you say to that person? I know I have some advice, but let's hear what you say.
Dr. Hammond, you probably went through this process much more recently than I did.
And you more recently than me, Dr. Oxford.
So yeah, I mean, okay, so I'll tell anyone, I think if you want to be a veterinarian, it's the most rewarding career, definitely pursue it. But my biggest piece of advice is to go get experience and make sure it's truly what you want to do before you go through all that schooling and invest in the student loans or whatever you need to do in order to pay for it. Definitely just go shadow at some veterinary clinics. Most of us are happy to have you there. We might not always let you touch things if you're just shadowing, but we're happy to have you there so you can experience it for yourself and see if it's something you truly want to do. That's just the best way to start your journey into the field. And then maybe you could even get a job as a kennel tech or a veterinary assistant or a veterinary nurse while you're in college, and then you'd really know for sure by the time you're done with that if being a veterinarian is something that you want to do. I think most of us start with some type of veterinary assistant background anyway before we end up in veterinary school, and then obviously get good grades, study hard in undergrad, and make yourself a well-rounded student. But all of that aside, the biggest thing is to get that veterinary experience and make sure it's truly what you want to do with your life.
Great. Well, let me, two more questions came in, and maybe Dr. Oxford, you could take this first one. What results have you been seeing in dogs on leap years?
Well, I have had some really interesting and unexpected results, actually. In most of the patients I've started them on, in the oldest of the patients I've started have responded the fastest and the most profoundly. So I guess I should have expected that, but I didn't really expect that. I've seen 16-year-old dogs that already had pretty classic symptoms of dementia within about 4 to 6 weeks start to show signs of improvement, like in the way they engaged with their owners, decrease in anxiety levels. And I also had a patient who, it's again a 16-year-old who I had been working with and measuring limb circumferences for years. I had been maintaining them at the same circumference, but after I think it was about 2 months of leap years, he actually started growing muscle in both back legs. That was, I never would have expected that. Just more active, like just better, their activity level and their mobility starts to really take off. And this is in patients that I've already been working with for a long time. So I know it's the addition of the leap years that has caused that. So it's been a really exciting process to watch.
Well, that's interesting that you mentioned the cognitive change with that dog with anxiety. Could you tell us a little bit more about that patient?
Yeah. So that patient would have a lot of nighttime anxiety in particular. Really, like most nights, he just wouldn't sleep very well, and the owner was getting woken up at least once a night by panting or pacing or something like that. Sometimes begging to eat, but it wasn't always appetite driven. And then also just pacing around the house kind of aimlessly, getting in corners and just kind of getting stuck, seeming to not recognize the owners. And little by little, each one of those parameters started improving. The owners, started saying, I didn't get woken up last night. And sometimes you have to prompt the owner because it's something that they wouldn't, notice otherwise. But how are you sleeping? And they're like, oh, wait a minute. Yeah, the past few nights we've slept really great, actually. So it's a really cool finding. And then just less anxiety. I mean, just less panting and aimless pacing around the house during the day and at nighttime. And then I've also seen that seems to correlate with improved sleep quality at night is better appetite for the early day meal. So a lot of my older patients, like, a lot of times the owners are saying they really stopped eating breakfast. They're only eating like dinner now. And typically within about 10 to 14 days of the leap years, the owners are telling me, yeah, they were hungry for breakfast. So, I think that has to do with, regulating that sleep-wake cycle a little bit better.
Yeah, interesting. Now, Dr. Hammond, here's a question. What advice would you have to give leap years to picky dogs that are a little finicky? I mean, it's a beef flavor, but some not all dogs like that flavor. So what advice would you give someone?
Yeah. So well, first, try it like by itself and just see. Sometimes you'd be surprised. I will say when you first open the jar of leap years, actually does smell pretty good. I hit it and I was like, oh, that's not bad. So, try offering it as is without worrying, because if you go in already anxious, like they're not going to like it, then they sense you're anxious about the product and they might be like, I'm not eating that. You're acting funny. So just go in, act like it's nothing, offer them the treat. If they don't want to take it, I'd say, try offering them several of the treats they like first. So do like 2, 3, 4 from your hand of treats they like, and then do the leap years. Because sometimes that's a simple trick. Works actually really well with cats. Just offer them something they like, and then the pill pocket or whatever it is. So do that with leap years. That can be helpful. And then another thing is trying to mask it. So, do you need to break it up into some pieces, put it in some peanut butter, offer it to them that way? That's usually a great trick for dogs who like peanut butter. Some dogs prefer cheese. You can, obviously we don't want to give dogs tons of peanut butter and cheese. I'm talking about little bits here in moderation. You can give them a tiny bit to help get that treat in, or something else that's really flavorful, that has like a strong taste that will, that they'll enjoy, that will help make that leap years more palatable. And then again, you could also just break it up into some small pieces and mix it in with their regular food, especially if it's small and you've kind of crunched it up and mixed it in with their wet food that they eat in the morning, or if they have dry food, you can still hide it in there. Usually that's an easy way to get medications down, especially if they're already flavored and chewable.
Great. And then Dr. Oxford, we have one more question here about tell us about the combination, the NAD booster and the senolytic. Why is it important to have both?
Well, it's really important to have both because inflammation can actually decrease your NAD levels. So the senolytic, as we talked about, is really helpful in decreasing inflammatory levels. So with less inflammation as a baseline, you're going to get better NAD boosting of your NAD levels. So it's great to have both.
Right. And for any folks watching who are not familiar, it's a monthly regimen, right? So the first 2 days of the month, you give the combination chew, which is the senolytic and the NAD booster, and then the rest of the month, the NAD booster. And the reason for that is that these senescent cells, these zombie cells, as you say, take about 4 to 6 weeks to reaccumulate. And so that's why it's a monthly regimen. Yeah. Okay. So I think, let's see, I think that's all of the questions. Well, I guess
I
I
did
would
see
add,
one. I'll just add. I saw one pop up on the bottom there. Somebody asked about results between small and large dogs. Are they consistent? And I
okay.
thought that was a good question. I thought we should touch on really quickly.
Okay, great. Sorry, I missed that one. Go ahead.
And
Well,
I'll ask Dr. Oxford because she's been using it longer than I have.
okay.
What what was the question? Just
Someone was
how is
asking if the results are consistent between large and small breed dogs.
oh yeah, I in my practice they've been very consistent. It age is relative, right? So I'd have a 16-year-old small dog that is probably the equivalent of about a 12-year-old large dog. Um, and it's typically right around that like 10-day to 2-week mark that you typically see at least one parameter start to improve, whether it's a cognitive parameter or a physical parameter associated with mobility, or sleep. But usually within that 10-day to 14-day window, I see some type of positive effect in both large and small.
Yes, and I'll also add to that, that leap years comes in three different sizes based on the body weight of a dog. And this is based on pharmacokinetic studies that we performed to understand the appropriate dose. Because some supplements may just take a human version and say, oh, if it's this much in a human, then we'll give this much to a dog and package it up. So what we did in the development of leap years was do actually bioavailability and pharmacokinetic testing so that we could understand what the normal NAD level was over the course of 24 hours, and then add in the combination and see what happened to that NAD level. So we actually figured out the dose. So the range of dosing on the bottle for the body weights puts dogs in that dose that we saw raise the NAD levels. Yeah.
Yeah, it's so well created. You guys did such a wonderful job with the manufacturing and the research.
Well, thank you. Yeah, we like to say that we're science. We're science, or we have a science origin and a passion for the human-animal bond. Because as you know, those old dogs really deserve our attention. So, okay, so I'll close with this question for each of you, and you can decide who wants to answer first, and that is, what do you most want for your dogs, your own dogs, as they age? Who wants to take that first?
I'll talk a little bit. I had a German Shepherd that I lost in November, and unfortunately, I lost Hugo before I was introduced to leap years. But really what I wanted for him, and it started so suddenly, it started with him just kind of slowing down on walks, and it felt like he was young until he suddenly wasn't. Like I feel like sometimes that happens in our dogs. It's like they're just doing so well, like it's this steady, and then it just drops. And that's kind of my experience with him. But I just wanted to keep him comfortable and happy for as long as I could and maintain everything as well as I could as I started to see him decline in his older age. And the hardest part for me was the cognitive loss. I mean, I could deal with the mobility stuff. I was like, my house looked crazy. I had stuff everywhere. I had the booties for him to help him get up. I had the yoga mats for traction. He had 3 different orthopedic beds around the house that he usually preferred to lay on the cool floor anyway, but I was really trying. I was doing mobility exercises with him. I had lasers and all this. It was a little psycho, but he was the love of my life, and I was going to do everything. But the hardest part for me was seeing the cognitive loss, and when he wouldn't come to me when I opened the door, and when oh my gosh, I lost him in November, and it's still just so hard to talk about. Yeah. But that was so hard for me. So just now I have a new pup. I got a rescue dog. I went down to the shelter a month later and picked me up a South Carolina street dog, I like to call him, and and I'm doing what I know to be all the right things, and I know that when he gets to be that middle age and maybe start to notice some slowing down in terms of mobility, we'll definitely be reaching for leap years and all the other awesome interventions that we have to help maintain his health span and maintain his cognitive ability and our bond for as long as I can, because that bond is so special. And the longer you have your dog, the stronger that bond is. And so it's so hard when you've had a dog for a decade and a half longer, and then you start to lose that. And that is just heartbreaking. And so for every pet I have, moving forward, obviously after my experience with Hugo, we'll just be trying to maintain their health span as long as I can. And I'm so thankful that I have leap years for that.
How about you, Dr. Oxford? What do you most want for your dog as your dog ages?
Very similar. My past German Shepherd, I would say she didn't have a long enough health span. She had a very good lifespan for a Shepherd with as many morbidities as she came to me with. And I maximized her quality of life to the best of my abilities. But at 12, she had a very acute decline, and within about 48 hours, we had to humanely euthanize her. I was actually grateful for that, for the acute decline, because it minimized her suffering. It was something that it was terminal. There was nothing I could do, and we just were able to, say goodbye. But for my new Shepherd, she's in great health, and I want to maximize her health span. I want to compress that morbidity curve as best as I can. So in lay terms, I want her to have like the longest lifespan possible with maximal quality of life. 99.9% of her lifespan, I want to be just a great life. No chronic disease. And then, like 0.1% at the end, she can, I would like that, the end to be just very quick and no suffering.
Yeah, great.
That's what I want for her.
That's what we want for ourselves as well, right?
Yeah.
Yeah. Yeah. Well, so I'll give a shout out. Thank you both. This has been a really stimulating conversation. I really appreciate the work that both of you do. And I know that there's going to be a special code for a special discount for folks who have watched this live. So that will be coming, I think, in the chat or somewhere. So anyway, okay, thank you. I'll let you get back to your evenings. Thanks for all that you do, and we'll talk soon.
Thank you so much.
Thank you so much. Yes, appreciate all the work you're doing.
Yeah,
thank you.
It's amazing stuff.
Bye now.
Bye.
Bye.